Mono County's behavioral health staff has been pioneering healthcare reform, developing a whole person wellness approach even before the Affordable Care Act was in place. No longer are mental and physical health care seen as two completely separate areas of treatment in this rural county of 15,000 residents. The result has been more collaboration, more efficient use of services, and more individuals being treated.
So in February of 2012, I became the director of Mono County, at that time mental health. We decided that we were going to use the California Institute of Mental Health small county care collaboration as a way to begin our new identity. Who are we going to be as I became director and we began to change the way that we interfaced with our community. We didn't know if the Affordable Care Act was going to pass, we didn't know if healthcare reform was going to occur, and we decided as a team, because we began to do everything as a team then, make our decisions together, kind of decide what we're doing with our monies, and really start to work more around what a community health kind of system as opposed to an individual mental health system. So we decided as a group that what we're calling whole person wellness was really the direction we wanted to head into. So then it was, how do you make a big cultural change from within, but how do you also begin to address the enormity of what the Affordable Care Act was going to look like? And we decided to do a variety of very small and simple things. So we began with some just general education internally around what do our clients look like in terms of their health. And through that we realized many of our clients didn't have a relationship with a primary care practitioner. But what we realized is there's quite a bit of a financial burden for folks, so that's why they weren't getting physical care. So then we thought, okay, what can we do here that begins to replicate what an experience a person has when they go into a physical care. So we started doing blood pressures. And because we're relatively small and we wanted to not have to be in a position where the front office had to figure out, wait, is this one of the people in the target population or not? We just decided to do it with everybody. That meant everybody on Medi-Cal, everybody that we see out of pocket, all of our mandated service folks.
At first, it seemed we needed really a culture shift in our office, because if we were going to talk about whole person wellness to our consumers, we had to get buy-in from all the staff, from case managers to PhDs, that we all believe that.
Hi, how are you today?
I'm great.
Oh, good. How may I help you?
Well, I don't know.
Do you need to make an appointment?
Yes.
Okay. What would you like to be seen for?
I'm not sure at this point.
Okay. Well, we can get your information and we can definitely set you up with an appointment. Would you like to get your blood pressure done?
Yes.
Okay. Well, let's come on in. It's only voluntary. You don't have to do it. But since you do, come on in and we'll get your blood pressure today.
We just created a small script when people would come back and say, why? Why do you want my numbers? Why do you want that? Since it was totally different, we just came up with a very short paragraph about your numbers are your numbers. What you do with them, you do with them. But it's important for people to keep track of their numbers.
We actually had very little resistance. Clients were really interested in that. And then through that process, we decided to start collecting some data, and we had a questionnaire that included a person's perceived wellness. How well do you feel?
And it became so easy that we started not just with all the mental health consumers. Of course, we're an integrated office, so we have alcohol and drug, our DUI, and behavioral health all together. And we started taking the numbers of all of our mandated services people, so all of our DUI folks, which had a really interesting outcome, because I feel like it became more, instead of, oh, I have to go there and pay them money for this stupid class or whatever they have to do, they became connected with our office. And some of those people have ended up, of course, having referrals for mental health services, not just the mandated services.
The department is now viewed by clients as being more accessible and approachable.
So now we'd have a flood of people come in for a class, a DUI class, and they'd all say, can you do my numbers, can you do my numbers? Which I took as, that was great progress for us.
We had some relatively low numbers in the beginning, but as the program went on, our numbers went up.
So whether that's because we became engaged with them, they were more aware of their numbers, they were connected with a primary care provider, I'm not sure, but I do know that the mix of all three of those together, clients' perceived wellness, how they were treated, and did they get what they needed when they needed it in our office. And those were all great numbers.
When people had some kind of connection with us, and got to talk about, even if you're here for a DUI and a mandated program, somebody says, hey, how was that soccer game? How's your daughter? You know, the blood pressure's lower, whatever. That connection really changed the face of how people saw us. Basically, it prompted many different systems changes within that we got to very organically as we kind of studied what we were doing and very slowly made changes as we were going out. With healthcare reform, as it was coming down the pike, there was a lot of talk about it. I think everybody knows that, whether you watched it on television, heard it on the radio, or, you know, I went to many state meetings where it's coming, it's coming, it's coming. But nobody really gave anybody direction about what that looked like, except for behavioral health had to be more integrated with physical health, and physical health needed to start being more integrated with behavioral health. So there's a lot of resistance, and, you know, like this side, the physical health side will say that the behavioral health side is too complicated. The behavioral health side will say that the physical health side doesn't care about what they have to say. I found that not to be true at all. I found that as long as we really went to the table and listened and tried to understand what does it mean to be a primary care provider from the physical health side, they have as many concerns as we do. They're just different, and they have different rules and regulations. So we sorted that out, and once we figured that out, that really helped us to help them understand what kinds of questions they could be asking of their patients that would help them determine whether or not somebody would be a good referral to us, and vice versa. It takes patience and it takes time, and I think that, you know, we gave it the time and the patience to unfold on its own, and everybody had to catch up, but with just the idea that we all wanted to do this, we didn't know how, and we were making it up as we went along. And so we did that in increments, and we did that slowly, and we would test out an idea for a period of time, and then we would add to the next thing.
If another county was interested in starting a program or a change like this, I would suggest, or what I would put out there is, it's very inexpensive. It's a small systems change for a bang-up outcome. It really is.
Give your staff people the opportunity to test things out and be able to make mistakes or try things for a period of time and do things incrementally. Don't try to do a big change all at once. And then listen really carefully to the information you're getting back. And then asking staff, what kinds of things do you already know about that aren't being used here at our clinic? And boy, there's so much talent.
There will be people that will say you can't, but I do believe that we can do this just little bits at a time, and it will spread quickly.
I want to thank CSAC for this opportunity. When we won the Challenge Award, it's really prompted a lot of different conversations community-wide because it was in the newspaper, and it allowed me and the rest of us to start talking about what we do in a way that made us, I think, very prideful in a good way. And it also made us be more exposed in our community in ways that people will come up and ask about things that they didn't used to ask us about.